Kevin Jefferson, the DC Foot Doctor. I'm at 7 p.m. Fitness in Upper Marlboro, Maryland, right outside Washington, DC. Today's video is going to be the impact of exercise on your feet and your feet on exercise. I'm here with the owner and one of the trainers here at 7 p.m. Fitness, Patrice Murphy.
Hey everybody, my name is Patrice Murphy. Like Dr. Jefferson said, I'm super excited to welcome you to 7 p.m. Fitness, where we welcome an array of clients from men, women, and children. Our whole purpose here is to help you get fit outside in and inside out. We offer boot camp classes, personal training, and of course mindset and fitness coaching, and a little bit of nutrition. But today, I'm excited to talk with you about the feet.
Yes, ma'am.
All right.
All right, let's get it. So if you're going to get started in any exercise program, it all begins at the bottom. It starts with your feet. If your feet are not right, you're not going to have a good workout. Patrice, what foot conditions do your clients come to you complaining about?
Oftentimes, my clients complain that their feet hurt during cardio exercises. Our gym is based on high impact, so we do a lot of cardio, so they specifically bring up plantar fasciitis. That's something I hear very often. And then I also hear them complaining of knee pain, maybe doing leg exercises or after their feet are fatigued.
Funny thing you should mention about leg pain, because leg pain often is associated with issues with the foot, whether they have high arches, whether they're flat-footed, whether they don't have the proper shoes. Those impacts as you strike the ground during exercise can come up the chain to the knee, to the hip, to the lower back, even to the neck and shoulders. So Patrice, when your clients come to you complaining about foot and leg issues, what advice do you offer them?
So the first thing I always ask them is about their shoes. A lot of times when folks are working out, they don't understand their training shoes, their running shoes, and then there's lifestyle shoes. Making sure that you're wearing the right supportive shoes for the right exercise is the first thing that I always suggest. The next thing I always talk about stretching, because tight muscles tend to present in one area where the problem might be in another area. So we hyper focus on the stretching before and after exercise and make sure they have the proper footwear as well.
Great, I'm glad you mentioned shoes. People always ask me, Dr. Jefferson, what brand of shoe should I wear? And I am not partial to a particular brand of shoe. I'm particular to the type of shoe, the proper shoe, like Patrice said, for the proper activity, and the right size and the right fit. Shoe size and shoe fit are not always the same. So if you're having issues with trying to determine what type of shoe to wear, talk to professionals like Patrice here, come see your podiatrist. We go over these things and help you pick out the right shoe, the right footwear for the activity that you're going to be involved in. You have to be concerned about the surfaces here, or whether you're going to be outside the park, you're going to be running, you're doing 5Ks, 10Ks, marathons, or you're doing high impact aerobics here with Patrice here at 7 p.m. Fitness. So you have to really plan, and your shoes are the most important part of the equipment when you exercise. All the great gym equipment is great, all that good stuff, but if you don't have the right shoes, you will not be able to complete her class. I've seen her work. She does not play. You gotta come ready, get your feet straight, and make sure you're wearing the right shoes.
Absolutely.
So without fail, at the beginning of the year like it is now, we're in the middle of February, we have people who go out to make those resolutions to get themselves back in shape, to get fit. And often, I'm already seeing them coming in with foot, ankle, and lower leg injuries. They weren't prepared, they weren't sure what they were doing, they weren't wearing the right type of shoes. So this time of year, and actually throughout the year, I see a lot of plantar fasciitis, I see a lot of bursitis, I see a lot of painful bunions and hammer toes and other deformities that were pre-existing that folks need to take into consideration when they get ready to choose their exercise program. So I'm going to ask Patrice, when folks are looking to start an exercise program, what should they be doing?
There's a couple things that I always introduce my clients when they're just getting started. I always make sure that they can set an attainable goal that they can stay consistent with. And that usually just starts with basic walking and focusing on their nutrition. Sometimes they try to go, like you said already, doing a lot very quickly, which tends to stop them quicker than they want to. So I always encourage them, let's set an attainable goal, maybe just getting in maybe 10,000 steps a day, which would include walking, which is very important to have the correct shoes. After you kind of get introduced to having somewhat of a habit, you pick an exercise format that you enjoy. That makes you increase your consistency. So that's why here we have an array of different classes. You can pick something you enjoy that will support you being able to be consistent throughout your workout program.
So now, Patrice is going to show us some exercises to get you ready, starting from the bottom so you can get here, wherever here is for you. Remember, it all starts with your feet. So when you start your exercise, you want to make sure you're good and warmed up. You need to have the blood flow into the feet, so you will have a great workout. Patrice, you're going to start us out with some stretches and move us into some exercises that are great for the lower extremity. Go ahead, Patrice.
Absolutely. So we're going to kick it off with a hamstring stretch. If you're not familiar with what that is, those are the muscles in the back of your legs. So we're going to stretch the hamstrings first. So you're just going to take your hands out to the side and just reach down to your toe, just like that. Yep. Come up slowly and then reach. Now, if you can't reach your toe during this exercise, that's totally fine. You're going to reach as far as you can without it being uncomfortable. In this position, you want to keep your legs as straight as possible because we're warming up here, okay? We're going to do one more on each side, then we're going to move on to the next one. Perfect, perfect. He has great form. All right, so now we're going to do some external hip rotation. So kind of back to what we were speaking about earlier as far as the whole chain being connected. Opening up the hips makes the legs a little more lubricant as you're doing your squats, your lunges, and all those exercises that are going to be contributing to your feet. So we're just going to bring the knee up, take a rotation around. Yep, we do. Now here, if you feel any discomfort, take it a little bit slower and then decrease your range of motion. As you warm up, you can increase the range of motion. Perfect.
Gotcha.
We're going to do one more on this side and then we're going to do the other way. Yep, so typically when you're doing this, go ahead and go to the left side. Typically when you're doing this, you want to do at least 10 per side to make sure that you're completely warmed up. Take your time with this. You want to make sure you're making a full circle. Perfect, just like that. So those are the stretches that I like to make sure we absolutely do when we're working the lower body. Okay, so now we're going to get right into the exercise. We're going to perform a squat. It's essential that you keep your weight in the back of your body on your heels here. Toes are right in front of you. You're going to just come and sit down like you're sitting in a chair. Perfect. Oh, he has a great squat. Okay. Let's do maybe one or two more just to show the form for the squat. Go ahead. Yep. Taking it down. So as you can see, his knees are not advanced to his toes. That's going to protect your knees. You're going to stay back, putting all the weight in the back of your heels. If you're unsure if you're doing that, just wiggle your toes when you're doing a squat. If you can't wiggle your toes, you're way too far from it. You need to bring that weight on back. Great job. Go ahead and take a load off. So we're going to do one more. This actually is beneficial to actually strengthen the calves. So you're not recruiting the hamstrings to do work for your calves. You're going to strengthen them so that it takes a little bit of pressure off the feet as well. So you're just going to come up on your toes as high as you can, hold it for a second, and come right back down. Perfect warm-up stretch if you're about to do walking, if you're going to do the elliptical, if you're going to get into a high-impact leg workout like you would do here. Perfect warm-up stretch to get some blood flowing to the feet, number one. Number two, to strengthen those calf muscles so they're not super, super tight after. And this can be done before and after your workouts. Perfect. So those are just a few. We have a bunch of exercises you can do for the lower body, but these are great for anyone at any fitness level. Whether you're coming just off the couch trying to get back into it, you've been doing it for a really long time, make sure you add those in.
Thank you very much, Patrice. Now, as I was saying, as Patrice was saying, we're going to keep preaching this until, I guess we just pass out from working out preaching. You have to start here. It all starts at the bottom. It starts with your feet. If your feet are not right, if your feet are jacked up, if you're having pain, you're not going to be able to, one, have a complete, thorough workout. So you're cheating yourself. Two. Number two, you're making yourself susceptible to injury. And injury is going to keep you out of the gym. Injury is going to keep you from walking around the neighborhood or around the local school track. So be sure to start with your feet. Like what you said, make sure you have the right shoes for the right activity. Don't wear just casual shoes to come in here and do this work. Don't wear just casual shoes to walk around the block. Get some walking shoes, get some running shoes. If you like to go hiking, if you're out in the woods, get hiking shoes. I do a lot of hiking. For those who follow me on social media, on YouTube, you've seen what I do on hikes. It is good work, it's grueling work. You gotta be ready for it. If you have issues such as chronic knee pain, hip pain, ankle pain, other joint issues, see your doctor. Get those checked out before you come in here and try to work with this lady. But she's gonna take you through some paces. And she's not gonna take it too easy on you just because you're new. She's got things to do, she's got people to train, she's got a community to help get healthy. Okay? So, start with your feet. If you have any issues, see a podiatrist. If you're here in the DMV, come see me. If you're here in the DMV, you're looking for a good place to get fitness, whether you're just getting started or whether you've been a gym rat for years, this is the place for you, 7 p.m. Fitness. Go ahead, Trace.
Thank you so much. Yeah, 7 p.m. Fitness is a community. We like to help people, and the only way that you can get help is you have some level of accountability. Whether it's you finding someone here, or you bring your best friend or your mother, come in and work out with us. Our client ranges from 14 years old to my mother who's about to turn 70. So it's a place for everyone here at 7 p.m. Fitness. And I look forward to sweating with you.
Check out her contact information in the description of this video. We'll be seeing you soon, and take care of your feet.